Alrighty, so today we have Dr. John Fasbinder. Dr. Fasbinder is a graduate of the University of Missouri Kansas City School of Dentistry from 1981. He completed an anesthesia program at Truman Medical Center in Kansas City, Missouri, and a fellowship at the American Dental Society of Anesthesiology and National Board Certification with the American Dental Society of Anesthesiology. Dr. Fasbinder practiced dental surgery and anesthesia through private practice in the Kansas City area for 40 years and currently practices at the Community Health Center of Southeast Kansas, a nonprofit institution dedicated to integrated medical and dental care, especially for disadvantaged populations. Dr. Fasbinder also lectures and teaches to both undergraduate and graduate professionals about dental care for patients of special needs. And we also have with us today Jeff Glasco. He's a CRNA and A.S.A. Jeff Glasco is a certified registered and founder of Advanced Specialty Anesthesia, LLC, and has provided mobile anesthesia in dental offices throughout Kansas City for over 15 years. He's the exclusive provider of the Kansas Neurological Institute. His group of nurse anesthetists provide anesthesia for young children and adults with special needs and sedation for dental procedures. And they're accepting Kansas Medicaid and private insurance. So without further ado, I turn it over to both of you.
All right. Thank you, Kathleen. I appreciate the opportunity today to help provide information and hopefully help people better understand and what this is all about, providing dental care, how to better care for the kids, the adults, how to maybe help instruct others, and hopefully answer your questions and concerns about dental care for those folks that you're concerned about with special needs. As Kathleen mentioned, we'd like to take any questions that you guys might have and address your concerns, especially if they kind of deal with others in the group. If you have questions, others probably do too. She has available this chat thing on this Zoom product, and you can also ask questions later too. So please speak up. If we get off on a tangent or a branch so we don't break off the tree, just try to get me back onto whatever. But I want to try to be as, I want to try to answer everybody's questions as much as possible. First, I'd like to go through the concerns that I see from a lot of patients and their families, in particular, how to best take care of the teeth of your people that are concerned, or how do you tell others to help take care of the teeth? Well, the best thing that we need to, one of the first things that comes to mind for me is patterns in helping them. You know, we can give an infant your finger and he'll grab it or she'll grab it. The same thing with the toothbrush. They're going to grab it, but that doesn't mean they're going to do an effective job at taking care of it. There's more to just grabbing a toothbrush or whatever to take care of their teeth. And there's more to take care of your teeth than taking care of the teeth and the dentition than just a toothbrush. So I want to go over a little bit about that. I think patterns are very, very important, and repetition of those patterns. If you start on one side and work the same way to the other side in the same patterns all the time, that's a very comforting thing for a lot of the folks in this kind of population. I think we all like patterns, and change is sometimes uncomfortable. So I think developing those patterns and that repetition is probably one of the most important things you can do. And of course, to do this with, I think what's important is the kindness and the love, but also the strength and discipline. You have to be strong enough. If we enable these folks to just do whatever they're going to want to do, you're not going to get a lot of stuff done. A baby will cry and not want you to change their diaper. But if you don't, we know the consequences. They don't like it when they have to get a vaccination. But as a parent or a caregiver, you understand the necessity of having to provide those services, even though it's not something that they'd like. So again, that diligence, and I think that those patterns to be consistent to be strong about those things. Blame it on, if you want to, Dr. John or somebody else. They say we've got to do this. And then you guys are the good guys, and maybe we're not, but we can live with that. There's a lot of resources I'd like to go through as far as things like Waterpiks and hourglass timers and diet, I think, that are also important. Diet is something I think that's really, really important. Sweets, kids love, and we see a lot of populations and a lot of people that out of kindness and love want to give them things that are not necessarily the best for their teeth. Putting things in their bottle or just letting them go to sleep with a bottle as kids, not a good idea. As soon as the teeth start to erupt, they can decay very quickly, some more than others. The sweets that you give them, if they stay on the teeth or anything that's real acidic for long periods of time, they'll rot them out. If you put a nail in a bottle of pop for a month and close it up, that nail will just about dissolve. We can pour Coke or any kind of pop, even sugarless pop, on a battery, and they tell you if you pour it on the battery on your car, it eats away the corrosion. Well, it eats away more than that in your mouth. It's going to eat away your teeth and obviously cause a lot of problems. So I think what's important is developing these patterns to kind of back up a little bit, be strong about these with love and discipline. And we'll go over some of these things that I've got for you today to show you. Where's my? Okay, this thing is basically it's an hourglass. It's glass and it's inside a plastic tube, and it has colored sand. And a lot of dental offices, you can and places like will have these, and they're cheap. They've got plastic on the outside, but it's dangerous to give this to a lot of your folks because they'll squeeze them, they'll bang them, and if they can cut themselves, even though it has plastic on the outside. So this is more of a visual aid. We like to use this, and don't expect it right at the beginning for them to be able to understand this. Again, with everything else, it takes repetition, it takes discipline. You have to keep doing these things and be strong about it. Your kids, your loved ones, those dependent on you, need that. What an hourglass thing does, basically two things. Number one, it gives them a focus when you turn it over and let the sand run out. This is something that sits on a shelf so they can see it right in front of them, but aren't going to grab it. And they can see that it gives them something to do and keeps them busy. It also, secondly, gives them a defined amount of time that you're going to be taking care of their teeth. These are roughly 2-minute egg timers, 3-minute. They're made in China and places like that, and they're not exact, so don't worry about it, but you can pick them up anywhere. And what we usually recommend is that if the child, the adult, etc., stops or has adverse behavior, you have to turn it over again and make them start over. But this gives you about 2 minutes to really take care of their teeth. And again, it's nice to let them, if they want to get involved in it, but do that after you've done yours. You need to spend a couple of minutes basically, and again, pattern, and you can talk to your dentist. I can go over this with you if you want to, but basically starting at one side and then working to the other, the same pattern. Some kids get upset if you don't use the same amount of wiggling on one side as the other. So everybody's a little bit different, but again, keeping that consistent and doing it at the same time. Most important time is probably at night before bed. The last thing that should go in their mouth after they have their last sip of juice or water or whatever should only be their toothbrush and the toothpaste, if you can. Now, some kids, as far as toothpaste, they're going to swallow it, they're going to eat it. If that's the case, because fluoride toothpaste, the stuff you buy at the store, generally the fluoride won't hurt you if it's a small amount. But if it's a large amount in quantity, like salt, like any other thing, even carrots, it can cause problems. So about the half the size of a garden pea on the toothbrush is really all you need. It's just like a type of something that just helps to clean them off. And you don't have to have that to do it. They also have toothpastes for kids that don't have fluoride that have a good flavor to them. If this works better, that's great. But the fluoride, what it does is it's a chemical that we found over many, many, many years in small quantities, like everything else, like sunshine, like other things, is actually helpful. If it lays on the teeth all night long, there's a couple of things that it's doing. Number one, it protects the outside. It inhibits the formation of this gunk on the teeth we call plaque. And a lot of kids, a lot of folks are mouth breathers at night. That dries out their saliva and makes them more prone to decay and gum disease. So having that be the last thing in their mouth is probably one of the best things you can do. A lot of people, if they can, they'll precede this with flossing the teeth. Yeah, I know you're probably saying, I'm not going to be able to get in there and do that. Well, there's some tricks you can try, and this is with all kids. Is if you take a piece of floss about this size, just tie it in a circle, and then you can make it like a little circle thing. It's easy to get in there, and then a lot of times you can get in there with that. The key is to get in between the teeth. If you look at your hand as if that's a row of teeth, you brush on this side, you brush on that side, but you're really missing all these areas in between. And if you don't get in there, you're missing about 2/3 of the area in and around your teeth. So it's really, really important to take care of that. If you don't, we get a lot of cavities. You may not see them at first, but they can cause tremendous damage and lead to a lot of pain and infection, and that's kind of the reason you're cluing in today. Couple of devices that really help out. Now, flossing is great. They make floss picks that help. It's a stick that has a piece of floss at the end. If the person you're helping, or if that's you, can get in there with it. Dexterity with the hands isn't always the best. There's a company called Waterpik, and I have no financial connection to them at all, but I love their products because these things will push water in between the teeth and do a pretty darn effective job and give these kids, these folks, a fighting chance if they're not going to use floss. They make several different kinds, and that company was great at giving me a couple of display models to use today to show you some things, and I highly recommend them. First of all is this thing. I don't know if you can see it. It's by the Waterpik company, and it's waterpik.com if you want to go there. Most of these folks, you can find this stuff online. You can find it on Amazon. You can find it at Walmart and places like this. This is probably one of their best. This is what I use. I love it. This is actually a combination of toothbrush and Waterpik. So it's not only using a vibration to get in between your teeth, but it's pushing water on it too. So you can do both at the same time. This has to sit on a counter. It's got to be plugged into electricity, and you can adjust it. It never will go strong enough that it's going to take the grout off a tile, thank God. But it's something that is really helpful. I love this device. It works out great. My wife and I both have it, and I think it's wonderful. But it has to sit on a counter, and that makes it difficult. There's a couple other devices that they make. This is probably my favorite for folks with special needs. This is also made by them. This is called the Cordless Advanced. They make several different kinds. This one basically sits on a counter, and you put water in one end like a squirt gun, and it just fills up that little basin, and the brushes can come out that are like that. It's brushes, and it it throws the water out at the same time. I love this. The cool thing about this is it's pretty much waterproof. Not like maybe a Timex watch in the commercials that can go under 30 feet of water, but you can take this in the shower. You can use this in the bath with them, and there's no electric cord hooked up to it. The other thing and you can do an effective job. Again, the pattern and doing the same way, but you're getting in between the teeth, and it gives them a fighting chance. This is what people miss a lot if they don't do that. I like this in that you can put body temperature water in there. The key about that is great is the fact that a lot of our folks have a problem with stimulation. If you touch them, they're very sensitive to it. If you hit them with cold water or warm water, sometimes it's going to shock them. It's going to scare them. But if you use body temperature water in this thing, they'll hardly notice it. And if you can do this in the bathtub or the shower, or wherever they're being bathed, this is very helpful. Again, this is more of a project that a lot of people need to do for them, as opposed to them doing it themselves. If you give this product to a lot of kids, you'll find your mirrors and your floors and your walls are all covered with water, and they'll have great fun with it, but it's not going to help their teeth. So these are great devices. They've got one that is that's less money. That is cordless like that basically you change batteries, and I don't like changing batteries a lot, so I like the one that sits on a counter and you don't have to change that. So I think those are great things. The other thing I wanted to mention, I guess right now I wanted to get in, how do you know when it's time to get them dental care? Do you have to wait till they're hurting or they're giving you signs of things? Or is it something you get in all the time or that you should do on a regular basis? Generally, a lot of people will go in about every 6 months for a dental checkup. Some offices are equipped and can handle most of those things. I'd suggest interviewing a dental professional to see if they can handle it. We also have a lot of specially trained people that can handle this too. Jeff Glasco is a nurse anesthetist, extremely competent in his group, and I've worked with him for many, many years. And he can come into the offices, and for folks that can't handle this, like some other patients do, he's able to put them to sleep for a time very safely. He's got a super great track record, and do it in a way that's we try to make as comfortable as possible. And then the folks have no idea what has gone on with them. They're kind of in a daze a little bit, but Jeff, I'll let you explain more about what it is you can do to help some of these patients.
Well, thank you, Dr. Fasbinder. And I apologize for my surroundings. I was highly encouraged to go to a volleyball or be carpool today for a volleyball tournament an hour away from my home. So I wish I was in my lab coat and better surroundings, but we have a mobile anesthesia practice that's been around for over 15 years, and we cover the entire state of Kansas, working with dentists in pretty much almost all regions, except Southeast Kansas, which is our last location where we will finalize our puzzle, should we say, as far as providing care and access. But pretty much what we do is we work with a lot of special needs adults and young pediatric populations to provide their dental care. Um, we are different in which we work primarily in the office setting compared to a hospital setting. There's similarities but much differences. The nice thing about being in an office setting is that there can be an established relationship with the dentist and the parent. And on one special day, we arrive and we assist getting that dental treatment done, and the patient still feels comfortable going back to that dental office. But there's many different components of what we do, but primarily everything's done through IV sedation. So compared to the hospital where we typically intubate patients for general anesthetic, we're able to do everything and accomplish everything by starting an IV and giving them a sedative throughout the procedure, and then basically let them recover there in the chair. So basically they go to sleep with the parent, wake up with the parent or the guardian, whoever, is what we call the friendly face, and go from there. The biggest question a lot of people ask is, well, I don't think my child can let them start an IV on them. And typically we kind of coordinate a plan with the parent dentist where we may do like a sedative before they arrive at the office, or simply what we can do is give them a quick small injection to make them really sleepy so we can get that IV started. But in the grand scheme of things, we can accomplish everything what we do in a hospital, but an office setting, and make it pretty much a transition easy process.
Thank you, Jeff. I wanted to add something else. The hospital is a modality, and surgery center is part of that we need to sometimes utilize. There are a lot of dentists that don't have the skills or the ability to get somebody like Jeff in their office to help do these kind of things. And sometimes they have complex medical issues that predispose them and they're judged by professionals and by you that it needs to be done in a hospital setting. This is a little bit more of a scary environment for a lot of the folks, although we try to make that as easy as possible. And we usually are providing a lot deeper and more involved anesthesia for that. In either way, hopefully these folks feel nothing, see nothing, hear nothing, remember nothing of that whole episode, so they're not afraid to go back. We get a lot of people, Jeff does too, that are what we call frequent flyers. They come back every once a year or so because that's the only way we can take care of them. Jeff, did you have anything else? Just chime in. Nope.
Typically, as far as what we call the frequent flyers is what we typically see, since it's such usually a big event, and depending on the situation of the child or the adult, sometimes we see them about once a year, just because there's so much coordination involved with transportation sometimes and long distances. So sometimes we'll see them about once a year. The goal is obviously what we see is about every 6 months. But once we get kind of an established relationship and kind of get things moving, basically what I've seen is that the first appointment, we do a lot of deep cleaning and kind of give the patient a fresh start. And with good habits, and as you're kind of indicating with patterns, then we sometimes are not called upon for a couple of years because they do really well.
Thank you, Jeff. Jeff was talking about getting them in for regular cleaning appointments, trying to get things done. I wanted to kind of follow that with a little bit about expectations for treatment. A lot of people come in and think that we're going to wave a magic wand, flip a switch on, and all of a sudden everything is perfect and stays that way. Well, one of the first questions we ask of parents and caregivers is, how well are you able to get in there and take care of the person you're taking care of's teeth? How good is their oral daily hygiene? Because a lot of treatment as to what we do and how we do it is sometimes predicated by what can be done at home. There's a lot of folks that you can't get in there to brush their teeth. You can't get in there to floss or use this Waterpik device. For those, we're patching small areas at times and taking a lot of teeth out. Some people grind their teeth terribly, and we can focus in on that to some extent if you'd like. What can we do? If the teeth seem like they're grinding them down to nothing, obviously we have to take those teeth out. Taking teeth out is one way to taking care of it, and that's probably a big, that's a big way we take care of things, but we like to try to patch things up and clean things up. But again, it depends on what you're able to get done. If we patch a whole lot of teeth and there's no dental care able to be accomplished, and that's not necessarily a fault thing, it just is. But if there's no oral hygiene care that's been able to follow up on and take care of, in a year's time, a lot of that can go bad. And then what have we really accomplished? So we have to look at the whole picture on these folks. The other thing is to try different methods and different ways to see, because everybody's an individual, what can we do to best try to take care of their health? What kind of repetition patterns, what kind of things can you do? And you just, rather than doing the same thing all the time, you try to figure out something that works. You have to be strong about it and realize, and again, doing it with love and kindness, but also that strength and discipline, that balance of the two, so that we can get as much accomplished as possible. All these things, using Waterpiks, etc., is going to give them a fighting chance. A lot of people, because they've got their hygiene care in between, and again, not a fault, I'm not bringing fault, they just can't get it done. And so we're taking a lot of teeth out until there's nothing left. Well, what's the problem with that? Well, the problem is a lot of these folks, they're really concerned about that. The mouth is very important to them. Chewing is really important. And if people try to chew and they don't have teeth, or they try to swallow things, they become a choking risk. And that's a problem in and of itself. Okay, Kathleen, I wanted to ask you if you had any questions that the group had about issues.
We just got one. First, I will be sending you, I'll be sending all the participants, Jeff and John's contact information at the end of this webinar. So you will be able to get in contact with both of them if you have more confidential questions or more specific questions. They're also asking how they might be able to get an appointment with either one of you. And if there isn't an actual diagnosis of ASD, but there might be a diagnosis for something else with sensory issues, if there are other diagnoses besides just ASD, do you have any recommendations for that, since there have been, since we've been focusing mainly on ASD? I'm sorry.
Well, I think Jeff and I both see a huge variety of people with a lot of things, and a lot of times they are complex. I mean, everybody's special with disorders, and some of them have a name and some of them don't. I would recommend calling either one of us, and she's going to give you that information, or you can contact the Community Health Center. If we've got an email, we can forward that to where we're at. Jeff works with lots of offices and hopefully some in your area that can hopefully help you out. But let me say this, sometimes people are afraid of having a label. And labels can be good, but labels can be bad. If you hide behind a label, that's not good. And you're afraid of being ostracized, etc. But labels also help to open up a lot of resources the state of Kansas and other states have to help with these folks. If you can accept a label, there's a lot of funds and resources, and Kathleen and the Autism Society can let you know about that, but I wouldn't be so afraid of a diagnosis. To us, it really doesn't matter if they've got a label or anything like that. We want to learn how to best help you help them. So whatever it is, bring them to us. We're happy to, or we can try to refer you. Kathleen has numbers and she can try to refer you or others to other areas. We're happy to help. I hope I answered that question. I'm not hearing anything. You got the sound muted.
Thank you.
Go.
Yes, no, it looks like our participant is thanking you, and that's such a great answer and relief. Just to touch on what you had mentioned earlier, we do have, it's a fairly short list right now, and I would love to talk more with Jeff about expanding our current list of dental practices that do specifically work with individuals who have special needs. So if you are interested in getting that list, I am more than happy to email that to you. And to all of our participants, I do have all of your emails because you did sign up through Eventbrite. So just so you know that as well, it's very easy for me to contact all of you. And I'm more than happy to send that information as well.
One thing I wanted to mention is, sadly, you've got a short list and there aren't enough people out there to do this. And it's really not a fault situation. A lot of dentists are just not trained at this. As of recently, this last July of 2020, we don't want to mention that dirty word 2020, but last July, the American Disabilities Association was able to push through a lot of strong and kind efforts, the American Dental Association and the American Medical Association, for that matter, to push to have training so that we can manage patients. It's a requisite now that all accredited institutions, dental schools, dental hygiene schools, etc., have to have ways of helping manage folks like the ones that anybody with special needs. They may not be able to treat, but at least having some pathways to getting this stuff done. The Autism Society is wonderful at being a resource. We're trying to get other resources. The states may have some resources if there's long lists you have to go through to get there, but the dental schools are starting to do that, and more people are getting more involved in it. But as you guys can see, a lot of times it takes somebody with special abilities and training, like Jeff, to handle these people. And not all offices are equipped with that, unfortunately. And again, I don't fault them for that. They just haven't had a lot of training in it.
That's our only question as of right now. Participants, if you have some more, keep them coming. But otherwise, I suppose you can continue with your presentation.
Well, that's basically the presentation.
Got it.
I put it in a small package, and I respect everybody's time,
Mm-hmm.
and thank you for that. And if you have other questions, maybe or somebody wants to speak up if there's a burning question.
Yeah, I'll ask one in the meantime. Jeff, you said your business really only visits dental practices in Kansas. Do you know of any like sister companies or anything similar in the state of Missouri, since we also serve families there?
Unfortunately, no. And the only reason why is that one of the uh, what keeps us in Kansas is statutes and bylaws and that kind of component of what we
Hmm.
do, and Kansas has a little bit more open interpretation of what we do. The other thing about it is that what basically I know that there are some resources on the Missouri side, and if they look at dental anesthesia, mobile anesthesia, dental in Missouri, they can do an internet search on that. They should find um, an anesthesia provider, and hopefully they can refer them to a dentist. The only component is that there might be a significant charge
Okay.
for that. But on the Kansas side, we have a very special relationship um, with the Kansas Medicaid managed care companies, and so we work with a lot of Medicaid patients, so Medicaid provided patients.
Perfect. Thank you. If you have another question, please go ahead and just type it up to me, or feel free to unmute yourself at this time. Okay, here we got one more. Do you have to have Medicaid, Jeff, or can you have other insurance?
Oh, go ahead.
Go ahead, Jim.
Oh, that's okay. Go ahead.
As far as private insurance is concerned, in the past, we had some difficulty with some of the private insurances because they got onto a component of a spectrum of autism.
Mhm.
Um, and it was always frustrating because we're like, well, we're just getting the referral. So obviously that means that, you know, there's a need for us to be there. But we do take a lot of private insurances as well. Sometimes, and we used to battle really hard and champion the patient really hard with their private insurances, but we found that there was a better battle that was done with the participant of the insurance plan when they were the ones that actually reached out to the insurance company and say, hey, look, my child needs to have sedation in the dental office. And this is the reason why, and it's usually gets covered a lot easier when they battle it compared to us.
Okay. We also have just a note here that, all right, that as kind of an alternative to anesthesia, ABA services can help target compliance to help make individuals with special needs just more compliant and more open to dental procedures. So I suppose if any other participants are already receiving ABA services, that is also something you can look into with your therapists and with your providers. I'd say we'll go ahead and we'll just wait 2 more minutes and see if we have any more questions, and then looks like 10:45 might be a good stopping point otherwise. Okay, we also had a question. Do either of you help with any orthodontic treatment?
I'll say this: orthodontics is challenging for autistic spectrum patients. Some folks are able to get impressions done, and there's plenty of orthodontists. If they'll sit long enough, they can make them these plastic trays called Invisalign that will work well, but you have to be compliant and keep these trays in the mouth on a regular basis in order to work. braces are fantastic, the metal kind that go on the teeth, but if they're not kept really, really clean, then the teeth can rot under these wires, and they're not being taken care of. So a lot of it has to go back to the daily oral hygiene and compliance. I don't have specific orthodontic offices in mind, but again, we're not magicians. And if a patient can sit still long enough, they can take impressions and put these things in their mouth and help to straighten teeth. But that's not always possible. Again, we're looking at realistic versus idealistic. I think first and foremost, it's important to get good compliance and good daily oral hygiene. Without that, orthodontics is a waste of time and money. I hope I helped with that.
That's Jeff. Did you have anything to add on your work with orthodontics?
I basically would compliment Dr. Fasbinder is that and I've all of my children have had orthodontic treatment, and I felt like I had an extra child each time, because there's just a lot of maintenance involved with all those wires and everything, and basically keeping that clean, even with a child that did not have any type of sensory issues, is tough. And we haven't worked with any orthodontists. We have not been referred to by an orthodontist to come in and provide that, because it would be pretty extensive, infrequent, for sedation to do that.
Alrighty. Do we have any last minute burning questions for either Jeff or Dr. John Fasbinder today? Alrighty, well, I will just go ahead and mention again that I will be sending all of our participants the contact information for both Jeff and Dr. John Fasbinder, as well as links to both of your businesses and practices, so that they can look further into getting an appointment with you. This recording will be turned into a webinar. So if you've missed anything, or you wanted to go back and listen again to Jeff or Dr. John Fasbinder, you are more than welcome to find that on our website. And then last, we will be having another Saturday seminar in February. That topic will be brain-body connections through nature play, with Well Wilderness Therapeutic Nature Center. So we just had a couple of people thanking you, and on behalf of Autism Society of the Heartland, thank you both so much for presenting today on this important topic. We really appreciate it.
Thank you. Your participation and allowing us to be part of your day today. Thank you. I hope things go well for you and your folks that you take care of.
Thank you.